Hello everybody. We are going to continue and we are going to end up with the last one, which is the goal number 6 in International Patient Safety Goals, which is prevention of risk from fall, or you can coin it as reducing the risk of patient harm from falls. So in this, the fall risk assessment is used by using the Morse fall risk scale. So here it will be comprising of the following items such as history taking, past history, secondary diagnosis, ambulatory aids, whether the patient is using, and whether the patient is on intravenous fluids therapy, whether the patient is having a good gait level, and about the mental status. So when we are going to assess this fall? Yes, we are going to assess or screen the fall during admissions and screen fall related injury risk factors upon and history upon admission. And also we are going to assess the risk of anticipated physiological fall. And we are going to communicate this risk to the staff members as well as to the patient attenders. And this will be a standardized intervention for all the patients who are at risk for falling. And we can also customize the interventions, that is, we can plan our interventions to prevent this fall risk. So this is a small example of what the Morse fall risk assessment scale for all adults. So this is actually a rapid and simple method to identify whether the patient is at risk for fall. So in this you will be having the variables such as history of falling, secondary diagnosis, whether the patient is using any aids, assistive devices, and whether the patient is on IV therapy or so on, whether the gait is weak, normal or impaired, and mental status. A total score of like around 46 plus is given. So when the patient is falling under the score level of 0 to 2, so there is no risk, there is no need for any other basic interventions. Low risk to moderate risk when the score is around to 25 to 45. So we have to plan in for implementing the standard fall precautions. And high risk, that is anything above 46 plus, will be receiving high fall risk prevention. In universal fall risk prevention or standard fall risk prevention, we are going to give anti-skid floors, adequate lighting, grab bars, all the accessories very close to the patient, removing the wet surface of the floors, especially in the restrooms, and educating the patient as well as the people who are very close by. And we are going to give the the patient call bell to the patient when he needs any assistance. And in universal, that is when it is high fall risk, then we will be giving a band, that is this yellow color band to the wrist, as well as a small card will be placed onto the patient head and to show that the patient is at high risk for fall. So what to be done in case a patient had a fall? So immediately a post-fall huddle will be planned. So in that we will be actually taking some events of what has been done to the patient, why the fall was done, whether we can prevent. So we can plan for a root cause analysis and we can avoid. So mostly an yellow arm on the patient's hand who are at risk for fall, speech therapist, and if case patient had an head injury, then plan for a emergency CT scan. And we can also have always the alarm bells very closely to the patient, teaching each and every patient attenders about the importance of fall risk. And that's all for today. And if you have any doubts or queries regarding the fall, you can please put onto the comment box and see that whenever we receive a case with especially geriatric clients or pediatric clients, try to apply the fall risk assessment and see whether the patient is in mild, moderate or severe risk for fall. Immediately planning for the intervention so that the patient is not going for at risk. So we, the nurses, will be the person who are at the front line to find out whether the patient is at risk and decide what can be done to the patient. Rather than, like always, prevention is better than cure. So even when the patient is saying that he is able to walk to the restroom by his own, and you know that the condition of the patient is very weak, his BP is very low, might be 60 bar Curie, there is no diastolic BP felt, then immediately you see that the patient may be catheterized or the patient may be given some amount of like urinals at the bedside to prevent the fall risk at the might be in the restroom. So we the nurse have to be professionally sound to prevent the fall. That's all for today. Thank you all. Don't forget to like, subscribe, and share. Thank you.